An eyelid lift describes either an upper blepharoplasty, in which the excess skin and sometimes the fat are removed from the upper eyelid, but also can refer to a lower blepharoplasty, where the fat and skin excess is removed or redraped from the lower lid, which can incorporate a lifting of the cheek as well. So an upper blepharoplasty is an upper eyelid lift, a lower blepharoplasty, a lower eyelid lift, or alternatively eye bag removal, it's often referred to as. An upper blepharoplasty on its own is usually performed under local anaesthetic. We frequently do it in the clinic here, and it involves a pre-planned area of skin to be removed with an individual decision as to whether we tackle some excess fat there, do something with the muscle as well. A lower blepharoplasty covers a range of procedures, from the most simple, where we're removing some skin and tightening the muscle, through to much more complex surgery that involves releasing some of the mid-face and lifting this up, all through a similar looking scar. So how we do the lower blepharoplasty will very much depend on what type of lower blepharoplasty we're doing, and that will determine whether we do it under a local anaesthetic or either a general or sedation anaesthetic. People who are suitable for blepharoplasty surgery include those who have developed excess skin on their upper lids, those with puffiness from the fat causing bags over here, those with crepey skin and skin excess here, whereas there are some people in whom we've got to exercise a little bit more caution when performing blepharoplasty, and they're typically people who've got a very lax, loose lower eyelid, some people whose eyelids or eyes tilt to a certain degree like this, and also some people, a little bit like me, who don't have very much bony support for their eyes, so their eyes are slightly protuberant over their cheekbones. And those people we have to take extra care in because of the way the scarring and the lower lids can react after surgery. So part of the preoperative assessment is very much assessing your suitability and really risk profile and outcome analysis for you as an individual. So an alternative to lower blepharoplasty is often teardrop filler, where filler can be put in to the groove here to mask the contour irregularities. And in some people this can be an excellent technique. I've often found it very good as a combination technique. So in some people I'm putting a little bit of teardrop filler in, but also doing a less invasive blepharoplasty to tighten up some laxity to the skin of the lower lid. However, it's also got to be recognised that it's not for everyone, and we've really got to understand what teardrop filler can achieve, and also what the risks are, which can sometimes be unevenness, lumpiness and puffiness, because there's very little camouflage from the thin overlying lower lid skin. The scars of a blepharoplasty, both upper and lower, are excellent. The upper blepharoplasty scars sit in the crease of the upper lid and often come out into the crow's feet. Similarly, the lower blepharoplasty scars also come out into the crow's feet, but are hidden under the lash line. How far they extend into the crow's feet is a compromise. It's a balance between not wanting them to be too long, but also ensuring they're long enough to deal with any excess skin to avoid any pleats or unevenness and irregularities in the scar and the skin beyond that. Risks from blepharoplasty surgery include inflammation and itchiness of the eye, particularly more associated with the lower blepharoplasty compared with an upper blepharoplasty. Bleeding and infection are risks in any operation, unfortunately low risk in this, although if bleeding does occur and it's not recognised, it can cause significant problems. In fact, unrecognised bleeding is why blindness is always something we discuss in blepharoplasty surgery, although I've never heard of anyone suffering that complication, but it is a described complication, usually as a result of unrecognised and unacted upon bleeding after surgery. In lower blepharoplasty, the area we're particularly worried about and concentrate on is the lid and the lid position itself. So we want to make sure it's not pulled down, it's not pulled out, and there's no malposition of the lid. So that's why a lot of lower blepharoplasty techniques will incorporate some lid tightening, something that will be discussed with you during your consultation.